Thank you all for having me, myself Sourish Dey, and I am going to be speaking to you today about ethical care of transgender patients. Ethics denotes a set of moral practices which controls human behavior or how the activity is conveyed. Morality is a matter that is intimately involved with every person and subject. In the case of transgender and gender diverse people, various problems arises when it comes to gender affirming care. Transgender refers to a person whose gender identity differs from the sex determined at birth. The issue of gender identity is related to a person's perceptions of being female, male, or alternative gender. In this article, the term ethicist refers to people who are involved in medical profession. We will also discuss how and why they should perform their moral duties in connection with this profession. First of all, there should be people here who are specially trained in clinical ethics and are able to deal with any situation. Biomedical ethics and clinical ethics refer almost the same thing as part of applied ethics. This indicates to the importance of a number of sensitive issues, such as necessary care of transgender patients, the provision of unbiased healthcare to the people in the LGBT group, etc. Many times, transgender patients have to face various difficulties while receiving health services. As a result, they feel comfortable refraining from seeking health care. But moral rules, the right to justice, non-discrimination will help transgender people overcome from all this trouble. The World Professional Association for Transgender Health is an international professional body that publishes information on transgender and gender variant persons' healthcare issues and their appropriate standards. In agreement with the policy statement of the American Medical Association and American Psychiatric Association, WPATH recommends that the healthcare needs of transgender people should be of the same standard and level as any other person. They should address any health issues appropriately. Although transgender healthcare rules and regulations are often not the same as those of general patients, that is why it is necessary to give proper professional training in this regard in advance, so that like other people in the society, they also get the same level of medical treatment and facilities. Health workers in all healthcare centers should provide services to transgender patients with the same dignity and respect as any other patients. Employees need to be provided services free from conventional biasless stories and other social prejudice, so that any act done by them does not cause disrespect or injury to transgender. Health workers must make sure that any physical examination done for medical reasons does not feel them discomfort. It is important to make sure that taking a personal appointment with a doctor does not cause panic among transgender people. It is important to ensure that transgender patients receive services from a doctor with care and sensitivity. When the issue of values is raised, the issue of morality is inevitable, because we know that without the help of appropriate moral rules and regulation, any successful ethical practice is impossible. Many ethicists refer four main principles when evaluating the merits of a medical procedure. Modern biomedical ethics seeks to address ethical issues related to patient-doctor relationship, fetal moral status, euthanasia, and so on. These principles are autonomy, beneficence, non-maleficence, and justice. Proper implementation of these principles will help to address the challenges that transgender patients face in assessing health care. Now we discuss the four principles. Autonomy. In healthcare decisions, we need to have respect for patient's autonomy because it can respect will of the patient. Transgender patients have the full right to receive health care with respect from health workers. Their gender identity should be recorded in the EMR system. It is important to consider whether the advice or consent of a relative is needed to resolve a patient's health problems, because we observe that in many cases they face various problems from the side of their relatives. Judging by those aspects, they need consideration. There are also some healthcare rules that patients have the right to decide on. Care must be taken so that they are not deprived of those benefits. Moreover, it is also a duty to maintain the confidentiality of healthcare. beneficence. The general meaning of this rule is that healthcare providers should always take positive steps for the benefit of the patient. In this care, the only principle should be duty for duty's sake. All of these responsibilities should be rationalized so that the right goal of treatment is widely adopted by healthcare workers. Through this ethical rule, a healthy relationship should be developed between the patients and the physicians so that the patient can have full confidence in whomever he goes for treatment. As a result, it will be beneficial for patient as well as the whole society. Healthcare for all patients should always be meaningful and understandable. Transgender patients may view mental health assessment as an important gateway to accessing surgeons and the legal changes. This approach helps transgender patients to be much more emotionally alert when making personal appointments. The third principle is non-maleficence. We need the principle of non-maleficence so that we do not intentionally harm the patient in any way. This principle is supported not only by moral benefits but also by law and biomedical ethics. This ensured the need for medical expertise, sometimes due to unintentional mistakes made by healthcare professionals. This policy introduced a fundamental commitment by professional healthcare workers to protect patients from harm. Therefore, this policy is very important in the field of healthcare for transgender patients. In addition to healthcare insurance, special care should be taken to ensure that these patients do not have to worry about gender or spelling mistakes. Moreover, it is necessary to think about the fact that the toilets of the laboratory or healthcare center are designed with their advantage and disadvantage in mind. The fourth and final rule is justice. In the field of healthcare, justice is generally judged from the view of transparency. According to Aristotle, everyone should be given what he deserves. By this we mean the equal distribution of the necessities for everyone in the society. When the question of continuous justice is raised, some fair way has to be determined for equal access for all, by which transgender people are also entitled to all the facilities related to healthcare like others. From the above discussion, it is clear that the primary matter that transgender patients are initially deprived of is the respect they deserve. Therefore, judging on the basis of values, it can be said that like everyone else, they also deserve proper respect which they actually deserve. They also deserve equal rights at all levels of society. According to the laws of nature, transgender people, like the other gender of the human race, also belong to the religion of humanity. So in terms of this, we can say that they also cooperate in social ethical policy. The principle of justice will be fulfilled only if we take care of them by making some initial changes in the structure of healthcare, and we will be able to fulfill our moral responsibility towards transgender people by following all these principles ethically. Thank you.